The United States has initiated a civil healthcare fraud lawsuit against CIGNA Corporation and its subsidiary Medicare Advantage Organizations for allegedly submitting fraudulent medical diagnoses to the government, inflating payments received for insuring Medicare Advantage beneficiaries. The lawsuit, which includes claims under the False Claims Act, was originally filed by a whistleblower in the Southern District of New York and later moved to the Middle District of Tennessee. According to the government's complaint, CIGNA paid third-party vendors to perform in-home health assessments for its Medicare Advantage members. These assessments were carried out by non-physician healthcare providers like nurse practitioners, who were not permitted to conduct diagnostic testing or provide treatment for any conditions identified. CIGNA submitted diagnosis codes from these assessments for government reimbursement, despite these codes lacking support from actual diagnostic tests or patient records from other healthcare providers. CIGNA certified these submissions annually as accurate, complete, and truthful, despite knowing they were based on incomplete assessments. U.S. Attorney Williams emphasized that CIGNA knowingly manipulated the Medicare Advantage reimbursement model, which pays insurers more for covering patients with complex conditions. Medicare Part C, or Medicare Advantage, allows private insurers to cover beneficiaries in return for monthly payments from the Centers for Medicare and Medicaid Services, CMS, which adjusts payments based on the health risk of the insured individuals. The complaint reveals that CIGNA's 360 comprehensive assessment program was designed to gather diagnosis codes that would increase its monthly payments from CMS, rather than to treat or care for patients. Internal documents show that CIGNA did not inform plan members that the visit's primary purpose was to collect diagnosis codes. The in-home assessments conducted were brief, and the healthcare providers did not have access to patients' full medical histories or records from primary care doctors. CIGNA's 360 home visits generated false or invalid diagnosis codes for serious conditions that would typically require more comprehensive testing. Thousands of diagnoses submitted to CMS, such as those for heart failure and chronic kidney disease, were made without necessary testing or supporting evidence and were not corroborated by other healthcare providers. CIGNA urged healthcare providers to code for high-risk conditions that would increase payments. Internal reports showed the program's financial impact, highlighting instances where additional Medicare payments significantly outweighed the costs of conducting the assessments. By submitting unsupported diagnosis codes, CIGNA allegedly violated the False Claims Act, as well as ICD guidelines, which require accurate documentation. CIGNA's actions led to tens of millions in improper payments from CMS. Explanation of the fraud in detail. The fraud centers on the misuse of the Medicare Advantage payment system, which adjusts payments based on patient diagnoses to provide extra funding for sicker patients who require more care. Here's a breakdown of CIGNA's alleged fraud scheme. Inaccurate diagnoses for financial gain. CIGNA's in-home health assessments collected diagnosis codes for conditions that were never adequately confirmed through testing. This process led to risk scores being artificially inflated, which increased the government's monthly payments to CIGNA for those patients. Vendor reliance and lack of proper testing. CIGNA hired third-party vendors to conduct brief, home-based health assessments. These assessments were conducted by non-physicians, such as nurse practitioners, who were not allowed to perform diagnostic tests or treat conditions. The diagnoses recorded on assessment forms often lacked clinical backing, as no testing, such as lab work or imaging, was conducted to verify the conditions. Pressure to increase high-value diagnoses. Internal records show that CIGNA encouraged its healthcare providers to diagnose high-risk, high-cost conditions, even if the health assessments did not justify them. The goal was to increase risk-adjusted payments, leading providers to focus on codes associated with greater reimbursement potential. CIGNA even tracked and retrained vendors who failed to achieve desired diagnosis rates. False certification of diagnosis data. Each year, CIGNA certified that its diagnosis data submitted to CMS was accurate and complete. However, the complaint alleges that CIGNA knew these submissions were based on unverified or unsupported diagnoses, thereby violating the False Claims Act.